Assalamu alaikum. This presentation is on the different types and designs of the surgical sutures and which suture to use in which surgical scenario.
Top of the list of the optimal suture qualities is the tensile strength of the suture, because this will permit you to use very fine sizes of high tensile strength material. It's also useful if the tensile strength is retained while the sutures are in vivo in contact with water and moisture, because some material degrade quickly once they are in contact with moisture. You want the material, if it's meant to be absorbed, to do this rapidly, because it's just a foreign body in the wound. We don't want it too rapidly before the tissue healing is finalized. You also would like to see a consistent, uniform diameter of the suture material, and this is usually achieved with the synthetic type of sutures. And if the sutures handles well and knots easily and securely, all the better. And of course, it should be free from irritating substances and sterile. The other important aspect of the suture material is tissue compatibility, the way it reacts with the tissues it's meant to hold. And ideally, of course, the suture material should be non-allergenic and non-carcinogenic and should cause minimal tissue reaction. If you look at the type of the tissue reaction, the inflammatory process surrounding chromic gut suture after a week of being inserted into the tissues, this compared to the minimal amount of reaction caused by a VICRYL repeat type of suture inserted again for a week or so. Sutures in the tissues act like foreign bodies, and some sutures are provided with a layer of antibacterial agent, chlorhexidine diacetate, for example. And there is good evidence that this helps in decreasing the incidence of wound infection. You could see the area, the zone of microorganism inhibition surrounding the suture material for different types of microorganisms, including Staph aureus here and MRCA here. And if you look with a higher magnification, you could see that the suture material that are not coated would harbor more colonies of microorganisms than their counterpart if it is coated with antibacterial agent. The smaller the suture diameter, the better, because this would decrease the amount of the foreign body within the tissue, to decrease the irritation and contamination, and also decrease the tissue trauma during the passage of big needles and big suture material. But this, of course, depends very much on the tensile strength of the material. If you have high tensile strength, then you can afford to thin out the suture into a very fine board diameter. The way the suture diameters are stated is a bit weird, because historically it started with sutures of about 0.4 millimeters in diameter. That was the smallest possible, historically, that was the smallest possible suture size. That's when natural fibers like gut and cotton and silk were used, and larger suture size took different numbers like 2, 3, 4, and 5. But when finer calibers were introduced, then they gave it a 0, and that was about 0.35 millimeters in diameter. And with the introduction of better material with higher tensile strength, the count actually started to reverse to the other way around. the smaller the diameter, the larger the number of the zeros you have. So it actually works up from here, from the 0 down to about 0.01 millimeter, and that's the 11 zeros. Most of the surgical work is done by the 30, which is about 0.2 millimeters. You do cosmetic skin sutures with an 0.1 millimeter suture size, that's the 50, and you do anastomosis of nerves and things, micro anastomosis with a much finer caliber with 0.02 millimeter, which is 10 zeros. By way of simplification, suture materials can be categorized according to 3 characters: whether the material is natural, like gut or silk, or synthetic, like polymers, and whether the suture material can be absorbed or would be absorbed within a certain time window, or it would remain inert in the tissues, and whether it's provided like a single filament or braided or twisted into multi-filament type of suture materials. We'll go through these. Historically, surgery started with the use of natural suture materials like silk or catgut. They're still in use at a much smaller scale because they provoke a greater tissue reaction and also have inferior tensile strength. And the synthetic products now available are made up of polymers of different substance, including nylon and PDS and things of the like. They are more predictable in the way they behave inside the tissues and the way they lose their tensile strength or get absorbed. They have higher tensile strength, so you can use very fine diameters of these sutures, and they can be provided like monofilament sometimes to ease their passage inside the tissues, and they are definitely less irritant than their natural counterpart. The natural sutures that are still in use include the gut sutures made up of purified collagen from the intestines. They are no longer made from the cat gut, they are made from the collagen and the intestines of sheep and cows. And you can use the purified collagen, but it absorbs very quickly, so it's only used for suturing subcutaneous tissue. In order to increase the strength, decrease the irritation, and decrease the absorption of the purified collagen, they are coated with chromic acid, and this is the coated gut type of suture. And silk is also still in use, although on a very limited scale. Plain gut and chromic gut sutures gets absorbed within weeks from their implantation into the tissues, while silk is meant to be non-absorbable. Silk is still in use because of its superior handling properties. They are second to none in the way they tie and handled while they are being knotted. They are provided as twisted or braided multifilaments, and they have a fairly good tensile strength for that reason. But once inside the tissue, they are not actually non-absorbable because within 2 years, most of the silk material will be absorbed and would be no longer identified in the tissues. And perhaps more importantly, within the first year, half of the tensile strength will be lost of that. So it's not really a non-absorbable suture. It's actually should be categorized like a very slowly absorbing suture rather than non-absorbing. And it shouldn't be used to fix prostheses and things like of the like in the body because of the loss of half of its tensile strength within a year and the whole of the tensile strength within 2 years. Synthetic sutures, which are mostly polymers, don't cause intense reactions inside the tissues and have much higher tensile strength and a very predictable degradation and absorption. They are provided in either an absorbable form that gets ultimately absorbed out of the tissues like VICRYL, MONOCRYL, and PDS, or a non-absorbable form including PROLENE and Dacron and Nylon. The third way of categorizing the surgical sutures is whether it is provided as a monofilament or multifilament. Monofilaments has certain advantages. They have a very easy passage within the tissues. They have a very smooth surface and that doesn't harbor much of the microorganisms. They are mostly synthetic with high tensile strength. That's why they can be provided as single filament, but they don't tie well because they retain some memory and they tend to sort of spring after being tied. They would want to retain their original position and shape. So the poor knot security is the real thing about monofilament, and extra threads would need to be placed with every knot with using monofilament type of sutures. On the other hand, the multifilament type of sutures have higher friction while passed within the tissues, can harbor microorganisms in the small cavities they have on the surface. Although they are mostly now coated, they should not be used in an infected wound or when infection is expected, but they handle very well and they tie very nicely. Monofilament sutures should be knotted with care, while you can use the standard square knot or surgical knot. With the multifilament sutures, if you are using monofilament suture, you would need to put on extra threads to secure the knot because of the material memory. The advantage of the monofilament sutures of least amount of trauma to the tissue and least or microorganism harboring on the very smooth surface lends it to be used in things like vascular surgery, where you don't really want any possibility of contamination. The other thing about the monofilament suture is that because they are monofilament, any damage to the fiber, the thread itself, while, for example, clamping it, would cause the thread to lose its tensile strength and break. So they should be handled with care, and if at all possible, you shouldn't be placing needle holders on the monofilament sutures. The examples, of course, include things like MONOCRYL and Nylon and PROLENE and PDS. Multifilament sutures are either braided together or twisted, and they offer more resistance in that while being passed inside the tissues, but that's exactly why they handle very well, because of their higher friction, and they also need fewer knots because of that property. The example includes things like the VICRYL, which is braided, chromic gut, which is twisted, and silk, which is braided. Suture materials can be either absorbed or remain non-absorbable within the body tissues. The distinction is made at the 60 days window. If the suture material loses its tensile strength within 60 days, then it is categorized like absorbable suture, even though you can still have some suture material inside the tissues. But if they have lost enough of their tensile strength, they are no longer functioning. If the sutures retain most of its tensile strength after 60 days, then they are categorized like non-absorbable. But as mentioned earlier, some of the suture materials that are categorized as non-absorbable sutures are actually very slowly absorbing sutures like silk or nylon. Silk would lose about half of its tensile strength within a year. So although they retain enough tensile strength after 60 days, this is not going to last forever. Within a year, they would lose half of its tensile strength and lose all the tensile strength at the end of 2 years, while nylon would lose about a quarter of its original strength within 2 years. So neither of them should be used for long-term placement of prostheses or for vascular anastomosis. The rate at which the tissue material loses its tensile strength is different from the rate which the tissue material are absorbed and cleaned completely from the wound area. These are two separate phenomena, the tensile strength degradation and the complete absorption of the tissues. Some suture materials would lose their tensile strength quickly within 2 or 3 weeks, but they would linger around in the wound for a much longer period after this while they are not functioning. They just act like a foreign body then. If you look into this diagram, you see that the tensile strength of the VICRYL Rapide is lost very quickly. Within 2 weeks, there is no strength at all in the suture, but it stays around in the wound for about 6 weeks, much longer than the 2 weeks in which it had lost its tensile strength and is no longer supporting the wound. VICRYL would take about 4 weeks to lose its tensile strength and would remain in the wound like a foreign body for about 60 days. The same applies to MONOCRYL. Although it starts at a high level of tensile strength, this is lost quickly within 4 weeks, but it stays in the wound for more than 3 months. PDS suture material loses its tensile strength more slowly and can actually be observed in wounds for more than 200 days. So tensile strength is usually lost much earlier than actually tissues are completely absorbed. The other important consideration is how much time does it take the particular tissue to heal, because if the tissues can heal and regain some of their tensile strength within days, then you can afford to use the fast absorbing sutures like VICRYL or GUT, and then you could eliminate the danger of having foreign bodies quickly. Whereas if tissues would need longer term support like tendons, that would need a few months before it regains enough of its tensile strength, you need to support it with suture materials like PDS that regains most of its tensile strength for a good few months. In some situations, like securing prosthesis in place or vascular surgery, you would need to use a non-absorbable suture that would retain most of their tensile strength for long term. Care must be taken while selecting absorbable sutures in patients who are feverish or protein deficient or have active infection, because the rate of absorption of the suture materials and the degradation of its tensile strength may actually be accelerated. So the wound may actually break down because of the rapid decline in the tensile strength. Also, with absorbable sutures, particularly the natural ones, wetting or moistening the sutures can actually start the absorption process prematurely. So in general, the advice is don't wet the rapidly absorbing sutures. You can moisten but never soak the surgical cut. Keep the silk dry. You can wet only the linen or cotton threads. That's in a very limited use nowadays, because that actually increases rather than decrease its strength. you'll have to be careful while bending the stainless steel wire type of sutures, because this is going to decrease its tensile strength dramatically. While if you are using nylon threads, it's good practice to draw the nylon threads between the gloved fingers to remove some of its memory. The rate at which the different types of absorbable sutures lose their sterile strength is the decisive factor in selecting a particular absorbable suture for a particular surgical task. Because if support to the ligated tissues or the suture tissues is only required for a short period, like a week or 10 days, then you may select plain gut or VICRYL rapide. If support is required for longer, like 2 to 3 weeks, then you could take things like VICRYL or MONOCRYL or chromic treated gut sutures. But if extended support is required, like for 6 weeks or so, then PDS provides this long-term support of the tissues and ultimately gets absorbed. The two processes of loss of tensile strength and the absorption of the whole of the sutures are different. Tissues lose their tensile strength first by degradation, and then in the second stage they lose the mass of the tissues itself by absorption, whether by an inflammatory reaction or hydrolysis for the synthetic sutures. The natural forms of the absorbable sutures were introduced earlier. One of the oldest types of absorbable sutures was the catgut sutures. They are now produced from the collagen derived from the gut of sheep and cows. And in its most purified form, they get absorbed quickly and also loses their tensile strength within 7 to 10 days. So they can only be used in superficial layers of fascia and ligate superficial small blood vessels. If they are treated with chromic salts, they can stay longer and also retain most of their tensile strength for longer periods, up to 2 weeks or so. So they can be used for larger blood vessels and also for tissues like muscles or mucosal layers. And then the synthetic absorbable sutures were developed. And they produce material that are less irritant, more inert, have higher tensile strength, drags more easily inside the tissue, and can be stretched into monofilaments or braided into multifilaments. They are formed from synthetic materials like polymers of different chemicals, lactic acid or glycolic acids. The VICRYL, which is coated, and the monocryl can retain most of its tensile strength for 2 to 3 weeks, but the PDS can retain their tensile strengths for much longer periods, between 6 and 9 weeks sometimes. And for that, they can actually do jobs like ligating or suturing larger blood vessels for the VICRYL and the monocryl, or used in deeper tissues. And the PDS in particular can be used when the healing process is delayed because of age or diabetes or oncological procedures, because they can retain their tensile strength for much longer. Out of all the synthetic absorbing sutures, the VICRYL rapide is the fastest absorbing suture. It loses 50% of its tensile strength within 5 days, but retains some strength for up to 2 weeks, much like chromic gut type of sutures. But they get completely eliminated out of the tissues earlier, at 6 weeks. They produce lower tissue reaction than the chromic gut sutures as well, and are useful in the closure of skin, mucosa, and superficial tissues. When the VICRYL sutures are coated, they produce sutures that have a superior handling properties, drags with minimal friction inside the tissue, and ties into excellent knots. They also retains most of their tensile strength in 2 weeks. About 80% of their tensile strength will be still there in 2 weeks, and 50% in 3 weeks, and even 20% after 4 weeks. They get absorbed completely within 2 to 3 months. They can be also braided into multifilament type of tissues. This is why it has superior handling properties, and because of the coating, it drags very well through the tissues. MONOCRYL is another synthetic absorbable suture that was developed to offer superior pliability. It handles very well and ties beautifully. It's also virtually inert, and it absorbs and loses its tensile strength in a very predictable form. It retains its tensile strength for a little bit shorter than the VICRYL, and can be used in the subcuticular tissue closures and soft tissue approximation that does not require long-term support. But if you are looking for a suture that will ultimately get absorbed, but it would provide support to the tissues for 1 or 2 months rather than 1 or 2 weeks before losing its tensile strength, then PDS is your perfect choice, because this material can be stretched into a monofilament type of suture, passes and glides very easily through the tissues. It has excellent handling properties as well, and its knot is fairly secure. It produces almost no tissue reaction or very mild tissue reaction, and it lose its tensile strength very slowly, so that it can offer good support to the tissues for at least 6 weeks. And in case you get confused about the different rate of loss of the tensile strength and the absorption time of the various absorbable sutures, we've discussed 7 of them in this presentation. This table summarizes them all. The tensile strength of the plain gut will be lost in 7 to 10 days. For chromic gut, it takes a little bit longer, between 10 to 14 days. VICRYL Rapid would lose all of its tensile strength within 2 weeks, much like the chromic gut sutures. The coated VICRYL would take a bit longer, because it still retains 50% of its tensile strength in 3 weeks and 20% in 4 weeks. MONOCRYL would lose most of its tensile strength in 3 weeks, especially if it is not dyed. The dyed form of it retains a little bit of the tensile strength in 3 weeks. It is actually the PDS that stands out from the rest, in that it retains most of its tensile strength after 4 weeks, and some of its tensile strength up to 6 weeks. When we get to the rate of the absorption, it's VICRYL Rapid that is eliminated completely in 6 weeks. Plain gut would take 10 weeks before it completely disappears from the wound, but it takes 3 months to clear the chromic or the VICRYL, and 3 to 4 months to eliminate the MONOCRYL, and up to 6 months for the PDS to be cleared completely. The truly non-absorbable sutures like PROLENE, polyester, and steel are fairly inert. They don't induce an inflammatory reaction once embedded inside tissues, and because there is no inflammatory reaction, they are not digested by the body, and they are not hydrolyzed by contact with body fluids or or water either. So they actually just remain there. What the body does to them is to wall them off by encapsulating the foreign body, the inert foreign body material, by a thin scar tissue. If the sutures are to the skin, lies outside the body, it should be removed. Otherwise, it would remain embedded within its very thin scar tissue. The earliest forms of non-absorbable sutures were produced from natural material like silk. Silk is produced from silkworm. It gives up a protein that can be spun into fibers, and these fibers are very slowly degraded inside the tissues and gets absorbed in about 2 years or so. It's used, still in use, silk sutures, because of its superior handling properties. It can be used to ligate larger blood vessels and can also help in the suturing of several soft tissues. Steel is another natural product that can be used to produce non-absorbable sutures in an alloy, of course. It's used when healing process is so slow that it requires long-term support, like tendons and craniofacial and cranioplasty procedures. It can also be used in the skin, like in staples. And eventually, synthetic non-absorbable sutures were produced. They are virtually inert. They have superior tensile strength. They can be shaped into monofilaments, which glides very easily through the tissues and can sometimes be braided into multifilament type of tissues. The commonest three types of the synthetic non-absorbable sutures are the nylon, the PROLENE, and the polyester, and we'll go through them one by one. The top advantage of the nylon suture is its superior tensile strength. They have so high tensile strength that they can be thinned out into very, very thin filaments like 9O and 10O type of monofilament type sutures. These very thin sutures need to be dyed by intensified black dye in order to be clearly visible within the wound. Besides its very high tensile strength, nylon sutures are virtually inert. They have very low tissue reactivity. They are produced in either the monofilament type of suture, like the ethylene, or they can be braided into multifilament, as we'll see next. They also don't get wetted with fluids, body fluids, and don't transmit infection along their surface. Because they are monofilament, the filament tends to regain memory with tendency to spring back to its natural shape and position. That's why more throws are required to be placed in the nylon knots. They are very good for ophthalmology and microsurgery procedures. When the nylon sutures are braided into a multi-filament type of sutures, they can be handled quite well, much like handling silk sutures. So they have more knot strength and ties more easily. They all remain with very high tensile strength and fairly low tissue reactivity, much better than silk, which induces an intense reaction. Nylon sutures would degrade slowly, like losing about 15 to 20% of their tensile strength per year, so they'll probably stay for about 5 or 6 years with enough tensile strength, but they are not advised for use in securing things like prostheses and things that requires long-term support within the body. What makes the PROLENE suture one of the favorites for procedures in general surgery, in cosmetic surgery, vascular, cardiac, plastic, or orthopedic surgery, that this type of sutures don't adhere to the tissues. So if you're doing a subdermal type of suture, you can pull out the PROLENE suture without much friction with the holding tissues. PROLENE is also inert, so it doesn't produce much of a reaction in the surrounding tissue. And it has high tensile strength. It is produced in a monofilament type with a very smooth surface, so it drags very easily within the tissues, and it is reliable. When you need minimal reaction, like in vascular surgery or cardiac surgery or cosmetic surgery, or when the wound is contaminated or infected, PROLENE is one of the best choices. Both nylon and PROLENE are very good choices for closing the skin, particularly in exposed areas like the face. Nylon sutures are more pliable, so it's more easy to handle, and they knot very well. So if you are doing interrupted sutures, like interrupted percutaneous sutures, maybe nylon would give you some advantages. But if you are doing a continuous suture, particularly if it is a subdermal type of suture that need to be pulled out, then the lower drag force of PROLENE is of particular advantage here, and this may be your favorite choice. Polyester sutures are available in their braided and coated forms. They offer a very high tensile strength, both to the suture material and the knot. So when this is of paramount importance, like securing prostheses and things, then polyester sutures are the one to be favored, particularly if there is some stress conditions, like if there is too much weight on the suture line. They also, because they are coated, they pass very smoothly, glide smoothly through the tissues, but they knot very well. Their knotting properties are very well because they are multifilament type of sutures. So they are in general used for soft tissue approximation, and they are used in cardiovascular, ophthalmic, and neurological procedures. And finally, the suture materials are provided in color-coded packages. So plain gut, for example, would be color-coded by yellow, chromic gut brown, silk like light blue, nylon sutures are green, PROLENE is royal blue, VICRYL would be purple, Ethibond would be orange, PDS would be gray, and stainless steel sutures would be silver.
By this, we come to the end on this presentation on the surgical sutures. Assalamu alaikum.